Hello everyone, welcome back to my channel. This is Bhavya Sharma here, and today we are going to learn about the muscle attachments and the clinical anatomy of the clavicle bone. In the previous video, we have already studied about the features, the importance and the site determination of the clavicle bone, and in this video we are going to learn about the muscle attachments and the clinical anatomy of the clavicle bone. Okay. Now we will go through the muscle attachments of the clavicle bone, and then we will go through the ligament attachments of the clavicle bone, and at last we will be ending up this video with the clinical anatomy of the clavicle bone. So if you want to remember muscles properly, see, just remember one thing, that is there are totally 6 muscles attached in your clavicle bone. Okay, 2 muscles are going to be attached in your lateral shaft, 2 muscles are going to be attached in your medial shaft, 1 muscle is going to be attached in your medial end, that is your sternal end, and 1 will be attached on your inferior surface. Okay, so first we'll go through the lateral 1/3 of the shaft. This is your lateral 1/3 of the shaft. See, you have muscle attachments. Some of the muscles are getting originated from the clavicle and some of the muscles are getting inserted in the clavicle. Okay, if you refer to the muscle attachment diagram in the textbook, you will find out that half of the muscles are colored in blue and half of the muscles are colored in red. So what does it mean is, the red colored muscles are your muscles that are getting originated from the clavicle bone, and the blue colored muscles are the muscles that are getting inserted into the clavicle. Okay, and the ligaments would be colored in green. Now one by one we'll go through the muscle attachment. Now, if you see in the lateral shaft, there are 2 muscles attached, as I told you. One is your deltoid and another one is your trapezius muscle. Now, the deltoid, see, we have 2 borders, right? Anterior border, posterior border, then superior surface is and inferior surface, right? So, from the anterior border, from the anterior border, the deltoid muscle gets originated. Okay, originated, that means it would be red colored in your diagram. So, anterior border is your deltoid, and from the posterior border of the lateral shaft, your trapezius is inserted. Okay, the deltoid gets originated from the anterior border of the lateral shaft of the clavicle, whereas the trapezius gets inserted into the posterior border of lateral 1/3 of the shaft of clavicle. Okay, that is all about lateral 1/3. See, it's mentioned here very clearly. Now, if we see the medial 2/3 of the shaft, there are 2 muscles originating from the medial 2/3 of the shaft. Okay, what do you know about the medial 2/3 of the shaft is, we have 4 surfaces, right? This is your superior surface, your inferior surface, anterior surface and posterior surface. So 2 muscles are getting originated. The first one is your pectoralis major. Pectoralis major is the large muscle, that is your chest muscle, right? So it is originating from your anterior surface, this surface. Okay, this is anterior surface, and the pectoralis major gets originated from the anterior surface of the medial 2/3 of the shaft of the clavicle. Then comes your sternocleidomastoid clavicular head. See, why it is said to be clavicular head is because it is getting originated from your clavicle, right? So sternocleidomastoid clavicular head is originated from your superior surface. Okay, from the superior surface, sternocleidomastoid clavicular head, and from the anterior surface, pectoralis major, that is your chest muscle. Okay, we have gone through 4 muscle attachments and the remaining are 2, right? So one of the muscles is attached in the medial end of your clavicle. Okay, so if you go in the posterior surface, that is this area, this surface, the smooth one, here if you see in the medial head, there will be 1 muscle attached that is originating from the medial head in the posterior surface, which is your sternohyoid muscle. See, this is the anatomical position. You just little bit turn it, and this is your posterior surface, right? Posterior surface of medial shaft. So in the posterior surface of medial shaft, near the medial end or the medial head, there is a muscle that is getting originated somewhere here. That is your sternohyoid muscle. Okay. And the last muscle that is going to be attached into the clavicle is going to be in the inferior surface. Do you remember that we studied in the features that there is a longitudinal groove known as subclavian groove? Yeah. So that subclavian groove has a muscle attachment. Any guesses? The same muscle that it has been named on. That is your subclavius muscle. Okay. So if we revise fast, there are two muscles in the lateral shaft of the clavicle. In the anterior border, deltoid gets originated. In the posterior border, the trapezius gets inserted. Then we come to the medial shaft. There are two muscles attached. In the anterior surface, the pectoralis major is originating. And in the superior surface, the clavicular head of sternocleidomastoid is originating. And then if we go a little posterior, in the posterior surface of the medial shaft near the medial head, we have origination of a muscle that is your sternohyoid muscle, and the last one is in the inferior surface. This is the clinical anatomy, a clinical position. Just flip it around. In the inferior surface we have a groove called subclavian groove where the subclavius muscle gets attached. That is all about the muscle attachments of the clavicle. Now we will go through the ligaments that are being attached into the clavicle. They are 5 in total. So the first one is your acromioclavicular ligament and the joint capsule. This is the joint capsule of your acromioclavicular joint. Okay. So acromioclavicular ligament and the joint capsule. From where does they arises? From the margin of the articular surface of the acromioclavicular joint. See, I told you that in the lateral side there is a facet present that articulates with the acromion process of scapula and forms the acromioclavicular joint, right? So this facet all over has a ligament that is your acromioclavicular ligament, and also the joint capsule of the AC joint, that is your acromioclavicular joint. Then the second one is your corococlavicular ligament. Okay, it has two parts, conoid part and a trapezoid part. By the name itself, you would have found out that it is present inferiorly, right? In the inferior surface of your lateral shaft, you have two features I told you. One is your conoid tubercle and one is your trapezoid ridge, right? So on the conoid part, that is on the conoid tubercle, the conoid part of the corococlavicular ligament is attached, and in the trapezoid ridge, the trapezoid part of the corococlavicular ligament is attached. As simple as that. Now the third one is your fibrous capsule, that is of your sternoclavicular joint. See what is written here, all around the medial end. So this is your medial end. This end is forming the sternoclavicular joint, right? So here in the medial end, all through the medial end, there will be the fibrous capsule of your sternoclavicular joint. See how is it possible is, this end, your sternal end is articulating with the clavicular notch of the manubrium sterni, right? So when they articulate, they need accessory structure for providing support to the joint. One of the accessory structure that all the joints have is your fibrous capsule. So the fibrous capsule is going to totally cover both of the articular surfaces to keep the joint on place, right? So here in the clavicle, you will have the fibrous capsule all around your medial end. Okay, the fourth one is your interclavicular ligament. This interclavicular ligament is attached on the superior surface of medial 2/3 of the shaft. Now, which is the medial 2/3 of the shaft? This one, right? Medial 2/3 of the shaft, and this is the superior surface. So the interclavicular ligament is attached in the superior surface, this surface of the medial 2/3 of the shaft. Then comes the last one, which is most of the time asked in the viva also, the costoclavicular ligament. Okay. If you remember, we have already talked about this word, costoclavicular. We have talked about this in the feature, that is your costoclavicular impression. Your costoclavicular impression is present in the inferior of your medial shaft, right? See this rough part? This is your impression for costoclavicular ligament. So here in the oval impression on the inferior surface of the medial end, the costoclavicular ligament is attached. Now let's revise it fast. The costoclavicular ligament is present in the inferior surface in the oval impression for costoclavicular ligament. Then if we go back, you have your acromioclavicular ligament and joint capsule on the facet of your lateral end, right? On the articular surface of your clavicle, which is for your acromioclavicular joint. Then you have coracoclavicular ligament, which has two parts, conoid part and trapezoid part. The trapezoid part arises from the trapezoid ridge and the conoid part arises from the conoid tubercle, which is present in the inferior surface of the lateral shaft. Then you have fibrous capsule that is all around your medial end. Okay. Then we have the interclavicular ligament, which is present in the medial 2/3 of the shaft of the clavicle. So that is all about the muscle and ligament attachment. Now we will go through the clinical anatomy of the clavicle bone. We have to study two things in this. One is your fracture and then one will be your congenital absence or imperfectly development of your clavicle. See, so the first one is the fracture. Fracture is commonly caused by falling on the outstretched hand. Okay, if I explain this, how it will happen is, see, for example, I fall down on my hands. Okay, so what happens is all of the weight of my body would be transmitted through my hand. The force would be transmitted through my outstretched hands on the floor to my clavicle, and then my clavicle will have a fracture. Okay, so now the second thing is the common site of fracture. It is between the two curvatures. What are the two curvatures? The medial curve, that is the convex curve, and the lateral curve, that is your concave curve. Between these two curves, there is a point of weakness where your fracture of clavicle occurs. Now imagine this clavicle bone to be fractured in between. So what will happen? The lateral end of your clavicle will be displaced downwards like this. Okay. And why that happens is because the trapezius muscle, it is not able to carry the weight of the upper limb alone. So failure of the trapezius muscle causes this. Okay. Then the second one that we see here is your cleidocranial dystosis. Cleido, C-L-E-I-D-O, C-R-A-N-I-A-L, cleidocranial dystosis, D-Y-S-T-O-S-I-S. You should be very clear about the spellings when you're writing your med exams, okay? So what is this? This is the congenital absence or the imperfectly developed clavicle. Either it is not present at all, either the clavicle is absent, it is not at all present, or it is imperfectly developed. That is, the development is not been proper and it has not been completed. So there will be incomplete development. So what happens because of this is the shoulders droop, okay, and there is anterior approximation of shoulder in front of the chest. See, this is a diagram in your BD Chaurasia book. So if you see here, see, there is the fracture of the clavicle. So what happens is the lateral end is displaced downwards because this trapezius muscle is not able to hold the weight alone of the upper limb. Okay. And if you see in this diagram, in the X-ray diagram, there is no clavicle at all. That is your second clinical anatomy, which is your cleidocranial dystosis. Okay. And if they are incompletely developed, the shoulders would be drooping, or they would be approximated towards each other. See, can you see this in this baby or in this boy? That is what is your cleidocranial dystosis, in which it is incomplete development. Okay. Okay, so that is all about the clinical anatomy and your muscle attachments of the clavicle bone. Here we are done with the clavicle bone anatomy, and I hope it was clear and it was of some help. If there is any doubt, please comment down in the comment section below. The notes would be available on my Insta page. Please check the description below for the link to my Insta page. Another thing that I wanted to tell you people is I am going to upload separate videos on site determinations. Yes, I have already done site determination and features of clavicle, but again I'm going to make a separate video only for site determinations for each bone hereafter. Why? Because you people will be very nervous and you would not be able to find small short videos for side determination and all. And side determination is the most important when it comes to practical, because you have to determine the side and tell them which side it is when it comes to your viva and your spotters. So I will make some 2 to 5 minutes video for side determination for each of the bones that we go through. Okay, so keep supporting, stay tuned, and yeah, stay home, stay safe, be safe, take care of your families, and take care of yourselves. If there is any doubt, comment down in the comment section below. Please like, share, and subscribe. Your support is all I need, and stay tuned for more. Thanks for watching.